First of all, I want to welcome all of you to this little orientation for the enhanced major in athletic therapy. We thought that it was important for us to maybe have this opportunity to give you some ideas in terms of where we are now in terms of the new program. We've had considerable number of changes happening, and we're now just approaching the time when I'm sure those people in the first and second year are considering applying for the enhanced major, and I wanted to make sure that everybody had all the information. And so the intent for today, for this evening's meeting, is just to do, first of all, the welcome and introductions, give you a little bit of the history, where we've been, what's the evolution of the program so far to date. And then to run through all of the revisions on our courses we've done. We've gone through a full revision, and we've now, as of May, we'll be starting a whole new program. Not a whole new program, but a revised program. And I want to make sure you know all of that. And then I want to talk about transitioning into the revised program for those students who are currently enrolled in the program. How do you transition into the program? A little bit about the application procedures and the deadlines, and then also a little bit on how we do the selections, what the criteria is, so that you're aware of what you need to hand in and what you need to do to prepare for your application. And then any opportunities for questions, we will do that as well. So the first thing is, in terms of introduction, I've listed the faculty members that we have here now. If any of the members are here, you can certainly, when I call your name, if you just unmute yourself and you can introduce yourself, or let it be known that you're here. First of all, I'm Glenn Bergeron, and I'm the program director for the athletic therapy program. And I teach, obviously, in the athletic therapy program, and I'm doing some clinical work there as well. And I've been here for a long time. Jeff Billick will not be here today because Jeff actually had some surgery today, and I haven't heard anything more about it yet. But so we wish Jeff well, and I'll certainly be giving him a shout afterwards to see how he's doing. And Valerie Pellick is our program coordinator, not the program coordinator, but our practicum coordinator, and she is on leave this year, as of just this week, and she'll be on leave for the rest of this year and all of next year. And Jeff Billick is picking up the coordinating of the practicum programs from now until May. And I am taking over her human anatomy and her prevention and care course. So we wish Val all the best as well with the new baby that will be coming very, very shortly. Robert Price. Robert, I don't know if you're here. Dr. Price. Yeah, no, okay. And Ben Trunzo, is Ben here? Maybe not. Okay. And then we have our department chair, Dr. David Tellis-Langdon. I saw you pop up there, David. So if you want to just say a quick little hi.
I am here. Hi to everyone. I am not an athletic therapist, so there's a reasonably good chance you don't get stuck with me as a course instructor. And I was just in a meeting with Dr. Price and Ben Trunzo. I don't know if they're going to be able to join us, but they were busy on another committee that I sit on.
Great. Okay. Thanks very much. Okay, so moving along on the agenda now, just to give you a little bit of a history of where we've been, dating myself, I think, somewhat, but the program was first established in 1998. So we do have a history now. We've been here for a while, and there's a lot of students have come through our doors, and we're pretty proud of that. But it's always been evolving. We've continually made some improvements here and there. Some of the major ones, obviously, is in 2017, we applied for the enhanced major program. And the enhanced major program involved now having students, rather than having them direct entry into the program in their first year, they would enter the athletic therapy enhanced major in their third year. And we would, partly because we had to limit numbers, because we just can't handle the kind of numbers and the interest that we have in the program. So we had to do something to try and get some control in terms of the number of people that could come in through our doors. And we did not want to have the issues that we've been having, in the last little while, in terms of trying to find adequate class space, lab space, and more importantly, practicum time. And so that's one of the biggest reasons why we did that. But like everything else at the university, these things take time to, once you get them approved, they have to be implemented. And so it takes about 2 years for things to get implemented once you've approved them. And so although it was approved in 2017, we officially launched it in 2019. So as of that time, anybody coming into first year was in the enhanced major program. So they would then register in their first 2 years of kinesiology. And after that, they would then join, they would now apply. So we're at that stage now where those 2019 students are now going to be applying for 2021. So they're now starting to enter into the enhanced major program. The other thing that happens whenever you want to try to implement new programming is that you have to essentially grandfather the people who were in our program prior to the changes. So we do have grandfathered students between 2019, 2022. So that essentially what that is there are third year students this year. They will move into the fourth year program. And then we have second year students who will move into the enhanced major program without having to apply. And this will probably be the last of that process, where we will have most of the students who were in that category will have gone through the system already. So those students who registered at the university after 2017, you are in that enhanced major requirement, which means that you apply for the athletic therapy program after your 60 credits. So you apply after your 2 years. So essentially what should have happened is that you would have applied to a major in kinesiology in your first 2 years. And then after that, if you still choose to do that, you would apply to the enhanced major in athletic therapy at the end of your second year to get into third year. So that's where we're at now in terms of that, the enhanced major and the 60 credit hour adjustment that we made. And then we decided that we needed to do a full curriculum review. And so we went and looked at our curriculum again to see whether or not we could make some adjustments to make it better based on, we had focus groups, we met with some of our graduates, we met with our faculty, we met with stakeholders, and we decided that there were some changes that could be made that would just enhance the program. Nothing really dramatic, but there were a few things that we thought we would like to add and a few things that we'd like to reorder. So again, in 2019, that curriculum was approved, but then it takes 2 years for it to eventually get implemented. So this new revised curriculum I'm going to show you tonight will actually take effect in May of 2021. So in a couple of months from now, this will be the official, it will now take effect and it will be in the calendar, etc. So in 2021, it'll be launched. And at that point in time, third and fourth year students coming into our third and fourth year program will be expected, they're coming in as cohorts. So the plan is that the students who apply in their third year, they will move into the fourth year together. So we expect that the students will to take the courses on a full-time basis and take all the courses and move together, and we will have people graduating as a graduating class every year. All right, so here are the things that we've made some changes to. So the first thing is that the year one and year two, as I've mentioned already, first year students coming into the university now will now register as a major in kinesiology. And one of the things that the department did a few years ago already was to look at the first 2 years and essentially make the first 2 years as close as possible to all of the streams, whichever streams you might want to go through. So the first 2 years are meant to be, you can take the first 2 years in kinesiology, and if you choose to come on into further on into the AT program, then you can apply to the enhanced major. If you choose not to, you just continue on with your next 2 years in your kinesiology degree. So we try and make it as seamless as we can, but there is going to be a few things that you need to be aware of. So in the year one and year two, as I said, you apply for your kinesiology major. And one thing that we've made changes to, and this probably doesn't apply to any of you, but it may apply if you know some people applying or anybody in high school now, that we've made a change to the math requirement. So we now require either pre-calc or applied. So the other math course, consumer math, is no longer accepted as a math requirement to get into the enhanced major in athletic therapy. In fact, I think there's movement that it will be that will be the case for the whole kinesiology degree. But for now, I can tell you that that's what it is here for, this is a major change for us. And then in your year one, you just need to know, as much as we want to make the first 2 years as uniform and similar for wherever you're going, there will be some things that we would like you to do in your first year if you think you're going into the BSc Enhanced Major. So we would like you to take that sport and exercise psychology and statistics. Now, sport and exercise psychology, this is a change that we've made where this is a significant change. In our enhanced major, we no longer require you to take intro to psychology. You can take it if you like, but it would be an added course. But you have, for our benefit, for our program, we're asking you to take 2 of our psychology courses within our own department, one of which we would like you to do in the first year. So sport and exercise psychology. In addition to that, we'd like you to take your statistics course in your first year, because we're going to ask you to do research methods in your second year. So at the end of the day, after your 60 credits, we would like, if you're coming into the enhanced major, we want you to have your statistics and your research methods already done. So we're suggesting you take your statistics in the first year, and then you can do your research methods in the second year, which I'll show you in just a second. Okay, so this would be essentially kind of a specific requirement in your first year that you should be aware of if your intention is to take the enhanced major in athletic therapy. Now in year 2, we, again, not a lot of major changes, but we just want to make sure that you're aware that human anatomy, scientific principles of fitness and conditioning, and the prevention and care course, you must have a B in all 3 of those courses if you intend to come out and apply for the enhanced major in athletic therapy. So there aren't many changes in the year 2, except to make sure that you're aware that if you don't get a B in these 3 courses, you will not be eligible to apply for the enhanced major. I think that's about it there for those 2. Year 3. Now this is the year 3. This is where you now become part of the cohort, and so this is where we made some substantial changes, but nothing huge in terms of content. So we have musculoskeletal support techniques. That is a name change, and that is our former taping and splinting course. And we've changed the name, and we've also broadened out the scope of what's being taught. So there will be taping techniques, bracing techniques. There will be some sideline management techniques as well that you can use. So it's essentially your old taping and splinting course. So anybody who already has taping and splinting will not be able to take this course. And then we also, the other thing that happened in year 2, we took out the practicum 1. So our whole enhanced major will only have 2 practical courses. So we've removed practicum 1 that we used to have in year 2. It's no longer there. And so the practicum, what used to be practicum 2 in your 3rd year, is now called practicum 1. I hope this doesn't get too confusing. We anticipate that if you've already taken practicum 1 in year 2, that we will allow you to take this practicum 1 as well for credit. So the practicum 2 one was a 3 credit hour one. We will be working on allowing you to take this course as well. They'll just have the same name, but they have a different number. Okay, so this one's KIN 3500, the other one was KIN 2500. So we're just doing that to reflect that we will now only have 2 practicum courses in the program. The other course that we made a name change to is soft tissue manual therapy. So this replaces our massage therapy or massage techniques in sport course. And again, this is the name is going to reflect a broadened content. So we're not only going to just focus, we're not only just going to focus on massage techniques, but we're going to do massage techniques, myofascial techniques, active soft tissue release techniques, a variety of different types of techniques that you're going to be exposed to rather than just massage. So it's going to be all soft tissue, hands-on technique. And the rest of the courses are the same, except for with the applied anatomy. So applied human anatomy still has the same name, still has the same course content. It has a different number. So it was 4301. We've now made it a 3301 to reflect that it's now going to be a third-year course. So again, if you've done 4301 in the fourth year applied anatomy, you would not be able to take this particular course for credit. So we've moved applied anatomy up to third year to give you more the applied anatomy. We do stuff in neuroanatomy, we do things in imaging, and we do lots of palpation. So we thought we'd move that up into the third year so that you have those skill sets when you go into the fourth year. All right, then we go into year 4. Again, some substantial changes into our year 4 program. So the things that we've done is we've added some required courses. So we now have physical activity, promotion, and adherence. It was a course that we had, but what's happened now is that it's going to be the other psychology course that we're using to replace our intro psychology. So we're no longer having you to take the first year intro psychology, but we're taking the psychology of sport and the physical activity promotion and adherence courses in our own program, which are the psychology focused, and they're going to count for your psychology credit. And then we've also added exercise physiology and chronic disease. We felt that it was important for our athletic therapists to be able to have the skill sets to be able to treat people through the full continuum, from pediatrics through to geriatrics. And so we wanted you to be aware of chronic diseases and be able to deal with patients who have those kinds of issues that are coming to see you for treatment. The other one, in much the same way that this Practicum 2 used to be called Practicum 3 in our third year, because we only have 2 of them. Now we've changed the name to Practicum 2. Content and everything else is the same. In fact, the course number is also the same. Okay, so it'll just be called Practicum 2 instead of Practicum 3. And then we've added yet another new course and this is in professionalism and kinesiology. And this is again to address the expanded scope, the scope of practice that athletic therapy is now brought forward with their framework, their competency framework. And it revolves a lot around professionalism. And so we are going to have a course that's going to focus specifically on professionalism. This course is not available next year. It will be available the year after. And one other change that we've made, we used to have you do an intro to business course within the Faculty of Business, Faculty of Economics, Business and Economics. And what we've done now is we've gone to business, and they have agreed to create a course that is much more related to what we do as practitioners, not only in athletic therapy, but also personal fitness trainers, people who are exercise physiologists, people who are in the kinesiology field who may be opening up private practices in some way, shape, or form where they're providing their services. So they've created a business course called Business Planning Basics, and I think it's going to be great. We've used a lot of the material that it's been piloted within our practicum programs in the last couple of years. And so we're looking forward to cooperating with business to provide the business planning basics course. So that in essence is the way the degree is now going to look as of May of 2021. In terms of the eligibility to apply, just to reiterate, those who are pre-2017, if you registered prior to 2017, you still have the benefit of direct access into the AT program without having to apply. We do need to know if that's what you're doing, though. We do need to know numbers, and I'll talk about that a little bit later on. So, because we need to know how many people we can bring in to the new cohort. Those students who are registered 2017 on, you are all required to fall within this 60 credit hour requirement. You do not have direct access to the athletic therapy program. You must complete your 60 hours, and then you must apply to get into the program. Those people who are pre-2021, so all of you now and anybody else, all of you now, you you can qualify to stay under the old curriculum as much as it is, so that if you have the practicum 1, we would still count it. It's not going to get lost. But you can still follow, and you don't have to take some of the required courses, such as the professionalism course or the chronic disease course. You don't have to take those. They're only required as of 2021. So if you're in the program prior to that, you don't have to take them. We certainly would encourage you to take them because they're in place for a reason. They're in place because they make a difference in terms of your ability to work as an athletic therapist. So we think that they're valuable, but we can't force you to do that. But what we do have, there are going to be the courses. For example, the massage course. We're no longer going to have a massage course. It's going to be the soft tissue management course. So as much as you say, well, I want to stick and take the massage course, well, it's no longer offered. And so you will then be required to take the modified courses within the system. And as much as we've said that the content is going to have more breadth, it's nothing that's going to be of a negative nature to you. Okay. So just so you know that if you choose that you don't want to take some of the required courses that we have in the curriculum, you don't have to do them if you are in the program prior to 2021. So prior to the people that we're going to admit into the program this May, if you are, then you don't have to do that. All right. But as of this May, everybody has to follow that. So as of May 2021, everybody that we admit into the program this year will be following and fully immersed into the revised curriculum. Okay, again, just to really quickly, just to reiterate some of the things that so now the eligibility requirements will be 60 credit hours. You must have 60, and they're the 60 required credit hours. So those courses that we listed in year 1 and year 2, you must take those courses. If you fail to not take one of those courses, then you may not be able to apply to the program. You also need to know that you need a minimum GPA of 3.0 after your first 2 years of 3.0 to get to apply to the enhanced program. I can tell you that the people that we've had so far apply in the last 2 years, the grade points are that and well above. I can't tell you at the moment what would be a cutoff point because we haven't seen enough people with that. The current standard, you also must have your current standard first aid, Red Cross or equivalent, and your basic life support. You have to have that coming into the program. So because you're going to be immediately taking first responder and spine. We're putting you into practicum 1 where you're going to be immediately into field settings. So you must come in with that. And it's got to be current at the time of your application in September when you enter into the program. Just quickly, in terms of selection criteria, how do we select people? We have a selection committee of our faculty members, and you will apply. We actually do have a scoring grid sheet that we look at your application, all the information you submit to us, and each one of us individually will score you on their spreadsheet, and then we get together as a group and we compare our scoring systems and eventually come to a consensus on what the score is for each student. And then based on that, depending on the number of students we're accepting into the program, we will look at that cumulative score and make our decisions accordingly. So what do we score you on? We do score you on your GPA. So the higher the GPA you get, the more marks you get, the more points you get. We mark you on your curriculum vitae. And basically what we're looking in your curriculum vitae is your, obviously the things that you've done academically, the things you've done in a volunteer, we want to sort of get an idea what the character, your personal character, your experiences you've had, real world experiences, your academic program, etc. But we're also looking at AT experience. So we want to look in your program whether or not you actually know what AT or athletic therapy is, and you know what you're getting into. And this is kind of to replace our P1. The P1 was in year 2. And the purpose of the P1 was really observational. We were asking you to spend 50 hours, 25 hours in a clinical setting and 25 hours in a field setting. So you would experience knowing what athletic therapists do in both settings, field and clinical. And then based on some of that experience, are you still, do you still have a drive and a desire to actually go into the athletic therapy program? Because the worst thing you want to have happen is you get into this program and then you start doing the practicums and things, and then all of a sudden you find out this is not what I want to do, and now I've got to make the switch. So we want to try and avoid that for you. We're trying to safeguard you against that kind of situation from happening. So what we're asking you to do in your first 2 years, year 1 and year 2, go out in this and get experience. Go and volunteer with another athletic therapist. Find out what they go and spend some time in a clinical setting. Get that experience there and write about it in your curriculum vitae and your letter of submission. So let us know that that you have had experience in athletic therapy. It's had a positive impact on you, and this is why you want to continue. You still want to pursue this. We're looking for that kind of tangible type of information from you to make sure that you know what you're getting into, and we're not going to set you up for failure. So that's what you're going to look for in your curriculum vitae. The reference letter, we're looking for a reference letter from someone who can speak about your character. If they can speak about you academically, if they can speak about you, what you're doing in your volunteer outside of the classroom, if they can speak about you as a person, if they can speak about your having sought experiences in athletic therapy, or maybe this was the person and they want to give you information about, they want to give us feedback about what you were like when you came in to spend time with them. That's all really good. So we're asking for one letter of reference. Okay, doesn't mean you can't put more in, but we're saying we need to have one, and we will score you on your reference letters. And then finally, we're going to score you on your personal submission. This is your letter of introduction. This is your letter that you're going to say, here's who I am. Here's what this is what my desire is in terms of my career, my aspirations in my career. Here's why I chose athletic therapy. Here's what I hope to be able to do once I graduate. This is why I'm coming to your program. And so this is a sales job. You need to sell us on why it is that we should select you over somebody else. So spend time writing that letter, get other people to look at the letter. It is a really important one. And as I said, we do score you. There's a scoring reference on that. These are all weighted scores. I don't have the weighted on them right now, but I can tell you the personal submission letter has a heavy weight to it, because we're looking to see how you write, how you communicate. We're also what the information you want to give us about who you are and why you want to do this program. So it's quite an important letter, and I would spend time doing it, and again, make sure that you have other people help you review it to make sure that you're delivering your message the way you want to have it delivered, so that we receive it the way you want us to receive it. Deadlines. So the deadline for the application to the enhanced major is April 1st of this year, or of your intake year, whichever time. So this is why we're doing this now, so that we make sure that you're aware that April 1, you must submit your application. You submit it to the office. You could submit it to Julie Ward, to the department office. We will be meeting in the month of April as a committee, and we will aim to have our decision done by the end of the month, and to be able to give you a decision by the 1st of May. The number of people that we're looking at taking in is considerably less than we have been taking in the last little while, when it's been essentially a direct entry, where we were getting 40 and 45 people coming in. We're looking at a target of 20 people. Now, the only thing I will tell you right now is that we do have a number of people coming in on our second year program, and we're thinking somewhere around 25 to 30 students that are coming direct access coming into our program. So we'll need to get a handle on that to determine just how many people we're going to take as a cohort this coming year. So it may be less than 20. I probably won't be more, but it'll be maybe less than that. So I'm just telling you that at the front end. And then in terms of your application form, the application for the enhanced major is on our website, on the department website. If you go into undergraduate degree programs and go to athletic therapy, the application form is there. Make sure you use the one that says enhanced major in athletic therapy. There is another one that we'll probably have to pull down. One last note is the CATA, MATA memberships. So my thinking is that you're taking the athletic therapy program because ultimately you want to write the national exam, certification exams with the Athletic Therapy Association. You need to know that the CATA requires that you are a member of the CATA at least 18 months prior to you writing the exam. And just so you know, it used to be 2 years, which meant that you would have to apply to the CATA before you actually got accepted into our program, which was problematic. So we went to the CATA and we had it put down to 18 months. So that just means, though, that if we accept you into the program this September, in December, if you want to write the exam in June 2 years down the road, you need to be a member of the CATA and of the MATA in December. And the reason why I say the MATA is because you can't be a member of the CATA without first being a member of the MATA. It's the requirement of the CATA membership. So, and that is on you. This is your responsibility to make sure that you follow those timelines. And I can tell you that if you apply late and say, I forgot, they're not very forgiving about that. And the reason why they're not forgiving about it is because they have such a huge number of people they've got to certify that they're going to cater to the people who show responsibility and follow the guidelines the way they should be. So they're not very forgiving if you're late. So this is on you, just to let you know that you need to make sure that you're applying at least by December if you want to write your exam in the following June. All right, so the last thing I have is a student survey. So some of you may have received a student survey from us. What we were trying to do is to try and get a handle on how many students were in our fourth year, our third year, and our second year. So that, because then we'd say, well, our third year going up to the fourth year. So how many of those have we got? And then our second year are going to be coming into the third year of this enhanced major. How many are there? So that we know how many people we can maybe take out from the second year who aren't direct entry. So we sent out a survey and a large portion of you responded to it. And I want to thank you very much for that. But there's about 30 or 40 people who have not responded. And we sent out a second request for reply. And again, we probably still have that same number of people who haven't replied. So all I'm saying is if you have not replied to the survey that we had, get in touch with me as soon as you can and let me know whether or not you plan to continue on with the athletic therapy stream. I'm assuming that if you've taken this, you're taking this orientation, that's in your plans. But if you haven't told me that through the survey, make sure you tell me that so that we can take account. And other than that, you can send me that through my email. And I think that's as much as I have there.